Are you feeling down or blue? Maybe depressed? Do you lack motivation? What about anxiety? Such a big problem today. Maybe you have difficulty shutting your brain off at night before sleep. These are issues. So, welcome back to the Dr. Jim Cares podcast. My name is Dr. Augustine from Head to Wellness, and today in this episode, I'm going to be talking about useful tips to improve your mood and emotion naturally. So, let's get into it. First suggestion, and these suggestions, I want to let you know this, have no conflict with medications. I've already checked that out. I want to make sure that if you're currently on an SSRI medication, that there's no conflicts with that stuff. I will say also that SSRI medication, right, serotonin reuptake inhibitor medication, really the statistics on it are not very good. It's not really very helpful. And the reason that it's not so helpful is because you're not really getting to the root cause behind the problem. And so I want to give you at least 3 things to do, maybe 4, because the last one is more significant. I would say that it's in a bigger picture of an issue that you need to really look at to solve these issues, because they are solvable. The first thing we're going to look at is GABA, gamma aminobutyric acid. It's a neurotransmitter, and it's sort of a calming agent. It calms people down. Usually when someone comes into my office as a new patient and we do testing and scans, we find that they're stressed out of their mind, they have way too much stress. And classically, the testing that we do, the special technology called the Scan Pro, it shows serotonin, dopamine, GABA, as well as acetylcholine. And we always see that GABA is skyrocketed because it's trying to calm a person down. It's amazing what your body does. It's a pretty amazing machine, so to speak. But GABA, it's a calmative neurotransmitter. It's been shown to help reduce anxiety and improve sleep. That's another great thing. And it boosts brain focus. So GABA, it's actually a supplement that you could take. And so that's something to try. Next thing would be taurine. Taurine, it's an amino acid and it plays a role in brain health, so it's a good thing. It improves mood, it reduces stress, and protects against cognitive decline, which you don't want those things. As you know, what's on the rise today is neurodegenerative diseases, so taurine is another useful thing that you could do. Similarly, too, you could try, and this is interesting, the statistics on this is some people absolutely love, and are addicted to coffee, because caffeine tends to be a neurotransmitter as well that affects brain function in a great way, and it improves concentration and focus, mental acuity, sharpness, that sort of thing. And they've shown in the studies that it tends to help prevent cognitive decline. Good thing to do. So taurine, that's an amino acid you can take that as a supplement. And then the last thing is probiotics. Now it's live bacteria that naturally lives in your digestive tract. So within your small intestine, it can actually move into your large intestine as well some. And by taking a really good probiotic, it improves gut health. Now here's the thing. Gut health is that bigger thing, the bigger picture, maybe the 4th aspect that I want to talk about, because your gut health seems to be very, very critical in the health of your brain as well. There is a direct connection between your gut and your brain called the vagus nerve. So whatever is going on in the gut is going to go on in your brain. So we like to say, or we've said this before, if your gut's on fire, inflamed, your brain's going to be on fire, and you're going to have problems there. And people have said, there's a phrase, I have a gut feeling about this. Your gut plays a huge role, and part of the reason it plays such a big role in your brain health is that you make neurotransmitters there. 95% of your serotonin is made there. So gut health, really significant. And taking probiotics, they've actually been shown in science to improve your mood, emotion, as well as anxiety, depression, things of that sort. So what a great thing to do. And so I would recommend, in my foundational work that we do in my practice is always looking at gut health, because your gut health or lack of health can cause heart disease, cancer, autoimmune disease, as well as neurodegenerative illness. So therefore, fixing, discovering, and testing the gut. And we do several gut tests. There's one test that's called the GI map. I love this test. It's a DNA stool test. It's very cutting edge, very comprehensive, and unfortunately, medicine doesn't do it. They won't even recognize it, which is really terrible. They are very old and archaic in their gut testing, and it's really a sad case because they're literally 14 years behind cutting edge science when it comes to that. So DNA stool test. Another test that we do is called a gut zoomer plus test. Gut zoomer is a significant and a bit more comprehensive in showing how many bugs, bacteria, virus, parasite, fungus, yeast, pathogens. It shows, and both of these tests, by the way, do this. They show intestinal health, they show parasites, they show how well your gallbladder is functioning, how well your pancreatic enzymes are. They show secretory IgA marker, which is how your immune system health is in your gut. So 70% of your immune system's in your gut. Therefore, it's really good to have good gut health. And probiotics will play a huge role in that. Also, zonulin. Zonulin's a marker of if you have leaky gut. Maybe you've heard of leaky gut or intestinal permeability. Now, few points about probiotics. All the companies out there purchase their probiotics from the same source. And let me tell you, with probiotics, you really do get what you pay for. You do not want a probiotic that's in liquid form, because liquid destroys that bacteria. And you don't want one that has to be refrigerated, because that's not as good of a probiotic as well. So same place you get them, but it will cost you for various different aspects of good probiotics. They're resistant, the ones that are resistant to your digestive enzymes, resistant to pH changes, resistance to temperature, resistant to water or fluids as well, as much as possible. So the more of those factors and qualities that you have in probiotics, the better it is, but also the more expensive it's going to be. So you need to speak to a good and reputable doctor that's going to give you good recommendations there. Something that you can look at that's a good indicator when you're looking at a probiotic. On the label, flip it around, look at the ingredients, and you should have the name of the probiotic, but then right after it, it should have in parenthesis what's called a substrain marker. Substrain marker. You won't see that anywhere. You can look it up on the internet if you like. But what it should show is like Lactobacillus acidophilus, and then in parenthesis it should have like IL-45 or something like that. That is the substrain marker. If it doesn't have a substrain marker, but it has all this other marketing information on it, probably not a good probiotic. It may culture cheese really well, but is it going to help you with your health issues? That's what we're after. So the substrain markers are definitive proof that it's really good for your health. And probiotics are a big deal, but I would go further than that and really make sure and check your gut health for all of those various different problems. Did you know that atrial fibrillation, irregular heartbeats, can be caused by a food allergy or food sensitivity? Good to know those things. So there's another reason why we should look at gut health. Gut health is a big deal. Probiotics, a significant factor. And these are all simple things that you can try that won't conflict with anything that you're doing. Doesn't conflict with medication, but as you know, anxiety, depression, and mood issues are huge. Another thing is, and that I hadn't mentioned yet, is liver. Checking liver function, and not liver damage, and that's good to do as well. So you do a blood test, your doctor does a blood test and says, oh, your liver's fine, your liver enzymes are great. And yet at the same time, you've got a lipid panel, a blood fat panel, right? The cholesterol, HDL, LDLs, triglycerides, those sorts of things, and those are out of balance. And that means, according in a doctor's world, it means that you have a statin drug deficiency. And I would suggest that you look deeper, because what causes liver issue, and that's an indication of liver issues when your blood fats are high. It's not a heart disease issue. It's a blood fat issue that's caused by liver dysfunction. What makes your liver dysfunction and raise your cholesterol is starch, sugar, and alcohol. So those foundationally, from a diet perspective, are the causes of liver dysfunction. Medications can do it as well, but when your doctor says we're going to put you on a statin drug, immediately ask him to do a fasting insulin. The patterns of LDL cholesterol, pattern A and pattern B. Pattern B, by the way, is the bad cholesterol, truly bad. And then also an apolipoprotein B test, and also glycated LDL cholesterol. Those are really good indicators of whether truly or not you have a cholesterol problem that's significant. But ultimately, if your cholesterol is high in the first place, it's caused by starch, sugar, alcohol, and maybe too much medication. So it doesn't mean you have a statin drug deficiency. So have them do those tests before you get on a statin drug, just to let you know. So what do GABA, taurine, and probiotics, how can they work together? Well, since GABA helps calm the brain and reduce anxiety, it's a good thing. Taurine also helps it protects your brain from stress and damage, which is another great thing to do. And then probiotics, of course, improve gut health, which can then have a positive impact on your mood. Good thing, good combination to try one or more or all of these things. And don't forget to check and test liver function. The seat of emotions in your liver, so usually liver can be another significant factor that plays a role in your mood and emotions. Hope this helps. Hope this helps. GABA, by the way, you can take it as a supplement, or in a food source, you can get it from yogurt or kefir, if I'm pronouncing that correctly. Kefir is more concentrated probiotics, by the way, which is interesting. Taurine, you can take it as a supplement or in a food source, such as eating more seafood. I'm personally not a big fan of seafood myself. I don't like the fishy taste, so I would rather take that in a supplement. But probiotics, obviously, you can take it in a supplement, or you can get it in kefir or sauerkraut, the fermented food, sauerkraut. Good things. So in conclusion, GABA, taurine, probiotics, all natural supplements that can help support your mood and brain health. If you're looking for ways to improve your mood and cognition or cognitive function, these supplements, I would say, suggest to be a really good option for you to try, with no side effects or risks to doing them. So if you need help with any of your health challenges, you want to look into this a bit more, feel free to contact me. I'd love to help you out. My email address is draugustine@gmail.com. You can reach out to my office at 562-860-3404. If you like this content, I'd love it if you give me a like and subscribe to my channel. That'd be spectacular. My YouTube channel is Dr. Jim Cares. Instagram, TikTok, I'm also on those social media platforms as well. I'm also on podcasts, Apple, Google, and Spotify as well. I'd love it if you like and subscribe to me there as well. And again, my name is Dr. Augustine from Head to Wellness. I hope this helps, and have a great day. We'll see you next week.